Hi guys, now we are going to study the anatomy of lungs. As we have finished anatomy of heart, next organ we have to study the thoracic cavity is what? Anatomy of lungs. Okay, so we are going to study about anatomy of lungs. You are not much little things you have to remember. Okay, because to properly understand about lungs, we need to know this one. You know, as you all know, we have two lungs, right lung and left lung. Okay, right as well as left. So right lung is heavier. Right lung is heavier to weighs 625 gram. This is an MCQ. Left lung weighs only 575 gram. There is a difference of 50 gram. Keep in mind. Okay, right weighs 625. Left weighs only 575 grams. Now right lung is having three lobes, right? Three lobes. Upper, middle and lower. Here only two lobes, upper and lower. Here each lobe is having how many segments we have? Total 10 segments. Okay. Here also 10 segments. Segments are same in both cases. Okay. Now you will see how the segments are divided. Just assume this as a lens. Okay. Just assume, not the correct structure, just for understanding. Okay, so we have a fissure. This fissure is known as horizontal fissure. And this fissure is known as oblique fissure. This is the right lung. So we have, this is the upper lobe, middle lobe and lower lobe. See, in upper lobe, total 10 segments, right? It's divided as 3 in the upper lobe, 2 in the middle and 5 in the lower lobe. Upper lobe have 3 lobes, 3 segments, middle have 2 and lower has 5 segments. So same way for the left lung, just assume this as heart. Okay, assume, I'm repeating, only assume this is not the correct structure. This is again oblique fissure dividing. This is your upper segment, upper lobe and lower lobe. Each lobe contains 5 segments. Okay. This is known as what? Cardiac. This is lingula. And this notch is known as cardiac notch. Okay. Now, lingula means it attaches the two lungs. Okay. And there is, heart is located towards left, right? Towards the left lung. So left lung is a little bit shifted because heart is there. So the cardiac placing notch is known as cardiac notch. So these are about the simple anatomy of heart. Now I have told you there are 10 segments. We will see what are the names of each parts of each segments. Okay, of each lungs. Same way, heart is lungs is also having one apex, one base and two surfaces. In the heart we have three surfaces here, one apex, one base, and apex is here only and base is here and two surfaces. That is one apex, one base and two surfaces. Okay. Now next thing we will see the segments in the right side. Segments in the right side. So we have three lobes, right? Upper, middle and lower. Okay. Remember A, T, A. Apical. Okay, apical, posterior and anterior. These are the three segments in the upper lobe. Now next one is middle lobe. Middle lobe contains medial and lateral. Okay. Medial and lateral. And in the lower lobe, very easy, just add basal to each of these. That is apical basal, posterior basal, anterior basal, medial basal and lateral basal. That is, here you have three lobes, middle 2 and here you got 5. So these are the 10. Very easy to study the names, right? Sometimes they will ask you what are the segments, apical, posterior and anterior. Remember that in the middle of here, medial and lateral. Okay. Now when you take the left side, very easy to remember. Left side we have two lobes, only upper and lower. In upper lobe, same apical, posterior and inferior segment. Add two more, superior and inferior. Here just add basal to this. What are they? Note to this, the lower lobe, the segments in the lower lobe of right lung and left lung are same. Okay, these segments are same. So just rewrite here. So in the lower lobe of left lung also we have what? Apical, basal, posterior basal, anterior basal, medial basal and lateral basal. So 5 and 5. Very easy, right? Both are same. The lower lobe segments are same. Okay. Now next important MCQ you are getting is, you have studied about segments, right? See, they will ask you, please, you have to remember each bronchopulmonary segment. We have studied, right? Each bronchopulmonary segment, they are having their own what? Their own pulmonary artery. Their own pulmonary artery as well as their own tertiary bronchi. Okay. So each is having their own tertiary bronchi and their own pulmonary artery. But pulmonary veins are common. Pulmonary veins are common for all segments. So pulmonary veins are one for all. But each pulmonary artery, each segment will get its own branch and it is having its own tertiary bronchi. Okay, so these things you have to remember about lungs. And something about trachea, that is also important. Trachea is our windpipe, right? Trachea. Now, trachea, or you can call it as our windpipe. The most common MCQ they are asked is the length of trachea. It's 10 to 12 centimeter, or you can call it 12 inches. Sometimes they will give you inches, or they will give you centimeter. Now, next thing you have to remember about trachea is, it is made up of cartilages. How many? 60 to 20 C-shaped cartilages. C-shaped cartilages make trachea, and they are hyaline in nature. They are not elastic. They are hyaline in nature. Next very important MCQ point. Now next thing they are asking you is that trachea will be dividing into what? Bronchi. And they will ask you, this division is at which level? It is at T4. The T4 level they will divide into bronchi. So trachea divides at which level? T4 level. Okay. Now next, one more question they used to ask is, which artery is supplying trachea? Very interesting question, right? Trachea is supplied by which artery? Remember, it is by inferior thyroid artery. Trachea is supplied by inferior thyroid artery. So these are the common things that are asked in MCQ in competitive exam that used to confuse us. Okay, so remember all these stuff. Okay, that's all about anatomy of lungs. We'll study the bronchial tree and other things in the next video. Okay, thank you.